Hi, welcome to Talkin Business. I'm Joe Catrambone, CEO of the Stuart Martin County Chamber of Commerce, and it's my pleasure to have Bryan Deering, who is the founder and CEO of Remedy Therapy, as my guest today.
Hey,
Thank you
Joe.
so much. Appreciate your coming up here to the wilderness of Port St. Lucie to meet with us.
Yes. Thank you for having me.
Yeah, my pleasure. Thank you. It's as I said, a lot of people don't like to cross the bridge.
Yeah.
You know. So, Bryan, I'm going to read this first paragraph so that people get an idea of who you are and basically what you want them to know. So, Bryan is the founder and CEO of Remedy Therapy, a behavioral health company based on Florida's Treasure Coast, obviously, specializing in treating addiction and eating disorders in adults. Remedy Therapy provides in network insurance based care and serves clients locally throughout Florida and nationwide, with individuals often traveling into the treatment center. That's really interesting, first of all, to know that an eating disorder, I never realized there was a treatment centers available
Yes.
for eating disorders. Um, so I have a couple of questions I'm interested in me, and I'm not sure it would interest other people. So your health insurance will actually pay
Yes,
for
sir.
these disorders?
Yes, Joe.
Yeah.
Yes. So health insurance covers behavioral health conditions. And like any insurance, they are going to pair with the provider to determine if you meet that criteria of care. But the individuals we seek that are going through acute withdrawal from drugs and alcohol, or in the case of women that are struggling with eating disorders, certainly if their condition is advanced enough, they would meet criteria to come into our inpatient facility and receive care. And it does cover their full length of stay. You will have a deductible and out of pocket like any other health visit, but we are primarily a network as a provider, and we chose to be a network so we can help more people. Because some of the out of pocket expenses when you're out of network are quite expensive. So it's a more affordable option. We're able to help more people. And yes, it's something that not many people know that your health insurance will cover behavioral health issues.
I don't know if this is an off the wall question or not, but is a eating disorder, is, is it mental? Is it physical, or is it both?
It's both.
Okay.
It's both. It starts psychologically, behaviorally. So really, it starts in the mind. And a lot of times when people have behavioral health issues such as addiction or eating disorders, it stems from some trauma that occurs at a usually younger age. And they learn to cope with the trauma or maybe some of the chaos in the home or even some abuse they're experiencing through controlled eating. Controlling their eating, whether not eating enough or eating more, can kind of give them a sense of control, and is a soothing thing as well. So, uh, eating disorders manifest in different ways. Again, some people are anorexic, which means they refuse to eat, do not eat, they
I know that.
restrict.
Yeah.
Bulimia is throwing up after eating or purging, which is the more appropriate term for that. And then there's people that also overeat emotionally to cope with feelings. So there's a wide range of it, but we help all women that fit in any of those categories that might need help, and especially if their eating disorder is advanced enough to where they're medically compromised. So one thing people don't know is that eating disorders have the highest rate of um, of death.
Really?
Yes, it is. Out of all the behavioral health conditions, the prognosis is really not good in eating disorders. They're the deadliest, I would say. And you would think it's opioid addiction or heroin or the you see a lot of that in the news, overdosing and dying from that. But actually, eating disorders are some of the deadliest behavioral health conditions you can
Would that
have.
would the death be caused by obesity?
More so, it's anorexia, which would be
Okay, yeah, I
restricting,
get
not
that.
eating.
Then that's you're not eating.
Not eating, and what happens is your electrolyte imbalances. So your heart uses electrolytes and electricity. If that imbalance is off, you can go into cardiac arrest.
Okay.
They also have organ failure. So if they're not getting nutrition to their organs, their vital organs, they will actually fail. Kidney failure, liver failure. And lastly, the most important thing is your brain. Your brain works off glucose. And so when individuals starve themselves, the brain is starved as well. You can faint. You can have neurological issues. So it is definitely more medical in nature, and is very very serious. Especially when we see them.
Yeah, I kind of understood that. I mean, obviously, anorexia, if you don't eat, you're going to die. But how about the other spectrum, the obesity? Where
Yeah.
does that?
Absolutely. Obesity leads to diabetes, leads to cardiac issues as well. Many people also die from that as well. Now, with obesity, there are new kind of medications that are out, GLP-1s, that help people reduce their body weight. The issue with those, though, is if you're eating because of stress or a coping skill, you may lose the weight with the medication, but if you haven't addressed the underlying issue of why you eat to soothe yourself, you're going to gain it back again. So that's why we tell people, either that are in the overeating category, that although there's medication, there's diets, there's all this kind of stuff that can help you in the short term, if you don't really do the therapy and the work to uncover why you eat as a coping mechanism and how to cope in healthier ways, you'll always end up back kind of where you started.
So, an obese child.
Sure.
I mean, they have no stress, or I mean, how do you handle that?
Well, children can have stress too. It's really
And then would
Sure.
cause an eating disorder.
Absolutely, yeah. With children, it's more so with the family. So, are their parents fighting at home? Are the parents divorced? One of the parents might be an alcoholic or using drugs. They might have been verbally abused or physically abused. Maybe a teacher, maybe other students. So these things can occur, and what children will experience is, again, that restricting. They could restrict for various reasons. Children could even restrict to get attention from their parents, because maybe their parents aren't paying enough attention. So now I'm not going to eat. So mom pays attention to me. So dad pays attention to me. And then they learn to build that if I want attention, I'm not going to eat. I'm going to refuse the food, or I'm going to say I'm not hungry. Feeding your child is one of the most primitive things that you can do, that a parent wants to do.
Yeah.
So if a child's not eating, it really gets you, right in the heart,
You know something's wrong.
Yeah.
Whether
and-
it's physical or emotional.
Emotional.
Something's wrong.
So, it's something that, people are learning more about mental health. They're learning more about family systems. A lot of all these kind of mental health issues, a lot of them do stem from family, cultures, how we're raised, things of that nature. And so our whole thing is just to teach people how to live a life that doesn't include drugs and alcohol, that doesn't include not eating or eating too much to make themselves feel better. That's a balanced way of living and a more healthy way of living.
So I notice that in your bio here, it says people are travel from out of the area. So you have a physical facility,
Yes, sir.
like a hospital.
Yes, yeah. So actually, our eating disorder facility, many locals will know, in Jensen Beach off Indian River Drive, that pink building,
Yeah.
that is known as Caribbean Shores.
Yeah, I know it.
That is the building that we have converted into an eating disorder
Oh,
facility.
really?
So, and our detox and residential facility for drug and alcohol is on US 1, South the Cove Road. Both of our facilities, I like to say that we're the Airbnb of treatment, because, Airbnb has gotten really popular because you could go and travel and stay at a place that feels homey,
Right.
as opposed to a hotel. Now, there's pros and cons to both, right? You're not going to get room service at the Airbnb, but you're going to feel more comfortable. Our facilities are more the Airbnb style, more homey style. You're not going to feel like you're hospitalized. You're not going to have the bright white lights and the stark white rooms and feel like you're kind of in a shoebox, so to speak. They're expansive, they're open, you're out in nature. especially on the river, at the St. Lucie River there. The clients are going to enjoy sunbathing, the wind, the animals. We see a lot of birds, we see dolphins. So, and believe it or not, that's all very therapeutic and healing.
Oh, sure.
Back in the day, sunlight therapy was a thing. Uh, all the hospitals were built by the water because they would like to open up the water, let the patients get the sun, the air, the fresh air. And we kind of lost that a little bit. So our settings bring that back, and our clients really, and our patients, I should say, really enjoy the setting, the healing setting of the ocean and the water.
So is it is it possible? Could it be mandated by the courts that someone
Yes,
be in your facility?
absolutely.
Can you lock them in, or I mean,
So
or is
we-
it, I mean, I know a lot of it would be mandatory, but
Yeah.
if the courts were to order it,
Yes.
how do you handle that?
So it's something I can share with your audience as well, which I think is really neat, is we do have a partnership with the Martin County Drug Court system. So actually, the Martin County Drug Court system, they will see an individual that might have gotten in some trouble due to a drug-related issue or alcohol-related issue, and the judge will give them the opportunity to go get help. And the county actually has a fund for this, and they remit payment to us for the services, and the folks do come to us. And because they're court ordered, they are mandated. So in one case, in that case that you're asking about, they are mandated. If they were to leave, they go to jail. So they're still not technically, we're not a lockdown facility.
Right, they're not in
They
jail,
could
but-
technically still leave, but the consequence of leaving would be they would go to jail. So in that case, there's that. In other cases where people are really a threat to themselves, there is two things. There's something called a Baker Act,
I know
where if
about that.
someone's suicidal or homicidal,
Right.
we're not a Baker Act receiving facility. That's a higher level of care, so we would refer them out. We work with Coral Shores,
Yeah,
New Horizons. Coral Shores is a Martin County partner of ours. But there's another one called a Marchman Act. And a Marchman Act is where family members can go to a judge and request that the judge, order this individual to go into treatment for their own good. And it's it's difficult to do. There has to be really strong evidence for it, but that is another avenue.
So what's the difference between that and Baker?
The difference is a Baker Act has to go to a Baker Act receiving facility, so a facility that's equipped to ensure that the person can't harm themselves. A Marchman Act can go to a lower level of care or residential level of care, and it's not so much centered around concerning around them hurting themselves as much as just mandating them go to treatment for their best interest. So the real difference is the suicidality issue.
So how do people in the Midwest know about your facility? You're saying people.
Sure.
How, do you-
Yes. Well, I'll say most of our folks are local.
Okay.
So I would say about 80% of our population are local.
Okay.
That is, and when I say local, it would be probably South Florida. We do get folks from Orlando, from Jacksonville. The folks that do come from out of state, they find us through advertising. We will advertise on the internet, on Google. We do a lot of AdWord advertisement. So when you go on Google and you search a keyword, for instance, you see those ads that pop up on Google. That's what we do as well. We also have a good social media presence that we do a lot of marketing with as well. And because we're a specialized level of care, people seek us out because in many places around the United States, these facilities do not exist, especially eating disorder. So, like you said, the Midwest, there might not be an eating disorder facility in their state. So for eating disorders, travel is quite common. For the detox and residential facility, not as much. It's a lot of local folks for us.
How do you handle eating disorders? I mean, how is that?
Well, yeah.
What's the facility like? I mean,
sure.
tell me about it.
It's definitely challenging.
It's got
but
to be.
That's why we hire excellent professionals. Everyone on our staff is a licensed individual and has been trained in eating disorders, has many years of experience. How you handle eating disorders, well, there's a combination. First and foremost, we have a medical director who's Dr. Lasardo, is our psychiatrist. He's actually been in Martin County for quite some time. So there's a psychiatric component to it. Every client's going to get a psychiatric evaluation, and it's going to be determined if maybe medication can help them, whether they have anxiety, depression, they might have mood disorders. So eating disorders are comorbid or co-occurring with general mental health conditions. So you're going to always see, again, some anxiety, some depression, some bipolar. These are other things that they battle with their eating disorder, and it's kind of how they cope with these mental health conditions, right, through their eating disorder. So first we'll be a psychiatrist. Then we'll do a nursing assessment with them, check their vitals, make sure we run labs, make sure their vitals are good, their heart's good, their organs are good, that they can actually continue to stay in our level of care, that they don't need to go to the hospital, that their electrolytes are good. So we'll do a workup on them, so to speak, to evaluate their body, their physical component of how they're showing up in treatment. And that will go on throughout their care to make sure they're good. Then the therapeutic component is just getting to know the client. There's something therapists do called a biopsychosocial, which if I were doing with you, I'd say, Joe, tell me from soup to nuts, from start to finish, your life story and all the major events that happen, all the things that, might have been very impactful for you. And that's
You're looking for a trigger.
Absolutely. They're gonna then get into the stuff that maybe their parents divorced, maybe they're abused when they're younger, they could have been sexually molested. These are things that the women we see have experienced and are usually the impetus of their eating disorder starting. So when the therapist can uncover that, they can start building what's called a treatment plan to start addressing those things that they've experienced. The final and probably most important component is a dietitian, a licensed dietitian, licensed nutritionist that will get with the medical provider and build a nutrition plan and a diet plan for that client. So something that people don't know about eating disorders is when people restrict and they do not eat for a long period of time, if they all of a sudden start eating again, there's something called refeeding syndrome that they could die from. It's very deadly because, again, I talk about those electrolyte balances. If you shift that balance real far in the opposite direction by eating too much or eating a certain thing, too much salt, too much sugar, your body doesn't know how to react to it. Their body has gotten used to living off of no food, essentially. So all of a sudden you give them food, it could be deadly. So the dietitian will put together a meal plan for them. And generally, BMI is a thing that we do look at. It's not an end-all, be-all number. Your BMI is a ratio of your height to weight ratio. It's an index. And we'll look at that index and we'll say, okay, this person might be at a 15, 16 BMI, which is pretty low, and we want them to increase. So we want to try for a half a pound, every 2 weeks or a week or a month. And so the dietitian's going to build a plan to get that person to start gaining weight and to get back in a healthy BMI. So at our facility, we do have a chef, Chef Sean. He actually was a teacher at Martin County high school at their chef program for over, I think, 20 years he's been there. So he's taught many students the culinary arts, and he also is really interested in working and helping people as a teacher. And so he's now with us, and he cooks all the food for the clients, and the clients love Chef Sean. Feeding someone is a very loving act, and preparing food is a very loving act. And our clients, our patients really do feel that love from Sean and from our facility. So, at the end of the day, the most important thing for us is to let people know that they are cared for, that they can heal, and that we care about them, and that we want them to get better. So that's what a person would experience in our care.
What's more prevalent, eating disorders or addiction?
Addiction is more prevalent.
It is.
Yes, addiction more prevalent.
And what's the drug du jour?
Well, I would say alcohol. Alcohol is the biggest.
Really?
Yes.
Wow.
Yes.
I would never guess that.
Alcohol is the biggest because alcohol is something that is quite acceptable. And listen, where's the line? Where's the line? Because that's a personal thing that people have to answer. Certainly the line can be if you get arrested for a DUI, if you lose your job, if your relationship problems, things of that nature. It could also be health issues too. So alcohol probably is the most prevalent. As far as a drug specifically, fentanyl. Fentanyl is the thing that we see the most as a drug.
Are are doctors supportive of what you do?
Absolutely, yes.
Yeah. 'Cause doctors are
Absolutely.
kind of strange ducks, and they're
Yeah,
not,
yes, absolutely.
so they would recommend people to for your facility or for your treatment.
I
A
would,
doctor would
I
do
would
that?
hope so. Are you speaking about a primary care doctor?
Yes.
Well, I would hope so. I do think that, I've had some discussions with primary care doctors. Primary care doctors are trained to be primary care doctors, right? They're going to do lab work. They're going to give you the talk about, maybe cutting back on some of the drinks or on the soda or whatever. But it can be intimidating for a doctor to approach a patient of theirs that might have been a patient for 10, 15 years about a potential problem with drinking. So it's a very delicate thing that doctors have to navigate. But certainly, if it was evident that someone was really hurting themselves with drinking, a doctor would recommend an inpatient detox facility for that individual.
Could a doctor remand someone to a facility?
Again,
legally?
it's very hard to do
Yeah,
that. That's
okay.
back
So-
to the Marchman Act thing, and
Yeah.
it's very hard to do that. It's because it judges our Constitution and our freedoms are the most important
Yeah,
thing.
right.
So those cases are very rare.
So we're kind of winding down.
Sure.
I could go on forever asking
Yeah,
you
I'd
questions about
love-
this, but is there something you'd like our viewers to know or that we haven't covered? That
Well, I think what's important for our viewers to know is that, mental health and these things we're talking about, addiction, they're scary topics. They're topics that most people don't understand. It's a little mystifying. How can someone become addicted? Why
Yeah.
can't you just stop?
Right.
What's so hard about
Right.
stopping or cutting back?
Right.
What I want people to know is that it truly is a disease. Some people have
Addictive personalities.
Addictive personalities.
I've heard that my whole life.
They do, and these are some of the most amazing people you ever
Yeah.
meet. By the way, they're
Yeah.
great characters.
And it
they're
could be anything.
charismatic.
It's
it could
not
be,
just food or
it
alcohol.
could be anything. It could
yeah.
be anything.
Yeah.
And what I want people to know is, first and foremost, don't beat yourself up. If you got a cancer diagnosis, would you beat yourself up? No, you would go see a doctor, right?
Yeah, of course.
It's the same thing. If you got an issue with something that you might be addicted to or you can't put down, go see a doctor. Go see a professional. Call us. I always tell people, call us. That doesn't mean you might need to come to us, but we have the resources. We've been in the business for a long time. We work with other facilities. We work with other doctors. So we can refer people to the appropriate level of care, to a therapist, to a psychiatrist. I want people to know that in the Martin County community, we want to be a resource for the community. When they're struggling in private amongst their family, maybe their teenage son is having an issue, maybe their relationship's having an issue. It's a very intimate thing you don't want to put out
Exactly,
there,
yeah,
and it
sure.
might be scary to talk about. They can call us, and we will give them information. We will help them. And I just want people to know to pick up the phone, make the call, and just start educating yourself, and don't be too afraid of having the conversation. Okay?
Bryan, thank you so much.
Thanks, Joe.
That
This
was
is
very
great.
interesting. Thank
Thank you, sir.
Yeah.
Thank you very much.
We'll be right back.